Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. I am a board certified internal medicine physician who's training to become a hematologist oncologist. And it is my passion and it's my pleasure to educate patients, common folks such as yourself, regarding various health topics to be well. It is my also goal to basically have patients to be health literate. Again, health illiteracy is a problem, and through education, such as podcasts, such as the one I'm doing now, is a pleasure of mine, essentially to improve that problem or to resolve the health illiteracy gap. All right, and so today our topic is bone health, specifically for women age greater than 65 years of age, women who are in menopause, postmenopause. This is important for you to discuss bone health. And specifically, I want to discuss a specific way to reduce osteoporosis and improve bone health. Talking about weight bearing exercise. Yes, weight bearing exercise is really important, especially for women who are postmenopausal, going through menopause, age greater than 65. Weight bearing exercise is actually an important tool, an important thing that we can do, an important activity that can be done to help reduce osteoporosis, which I will talk more about that, but essentially to improve your bone health. It turns out that once a woman goes through menopause and finish and done with menopause and now postmenopausal, the risk for osteoporosis is high because it seems as though the hormone estrogen is really a hormone that's instrumental in improving our bone density and our bone mass, and in turn improving bone health. And so when we lose that hormone or that hormone starts to decrease because of menopause, then it seems as though now our women are more predisposed to fractures because of reduced estrogen and because of increased risk of osteoporosis because of reduced density in the bone. And so, in order to improve the bone density, one of the ways we can do that is with weight bearing exercise. And you may have heard the term weight bearing exercise, but a lot of patients are confused with what is weight bearing exercise. Well, it's really simple. It's basically an exercise that involves you using your own body weight with your own 2 feet. So basically, an exercise that requires you to stand on your own 2 feet and use your own body weight in order to perform the exercise. That is considered weight bearing exercise. And why is it important? Well, it turns out that weight bearing exercise, because it's an exercise that or supports your own body weight through using your bones, muscles, and joints, it can be really beneficial by applying this own pressure, your own body pressure, your own body weight. It can help with your bone health. And so weight bearing exercises can help increase bone density. It also can slow down the bone loss. It also can be especially important for women as they age. So as you go through menopause and get to the postmenopausal state, it can really help. And so we understand that bone density loss can increase your risk for developing osteoporosis after menopause. And so that's why it's really important to do these weight bearing exercises in order to improve your bone health. All right, so I want to discuss a little bit about osteoporosis before I get into the different examples of weight bearing exercises. And so, osteoporosis typically develops in women age greater than 65 because of menopause, because of the loss of estrogen. So, therefore, it's something that we screen for. And we follow the United States Preventive Services Task Force, the USPSTF, which recommends that women age greater than 65 get screened for osteoporosis. And so, how do we do that? Well, we do that with something called a DEXA scan. It's basically a fancy way of saying we scan your bone for to assess its density. We're trying to see how dense your bones are. The more dense, the better. The less dense, the more chances you are of developing osteoporosis. And also, the more chances you are of developing a fracture. That's what we're most concerned about is the fragility, the fragility of the bone. And so the less dense, the more chances you are of developing a fracture. All right. And so that's what we want to prevent. And so we use this DEXA scan, which we recommend every 2 years being scanned with the DEXA scan to assess bone density. And essentially, we could use this tool to diagnose osteoporosis. All right. And so that's osteoporosis is basically a fancy way of saying that your bones are less dense, meaning porous. Um, and so because your bones are less dense, it put you at risk for fractures. That's what we worry about as doctors with our patients with osteoporosis. And so obviously we want to prevent osteoporosis because we want to prevent fractures. And one of the ways of preventing osteoporosis and in turn preventing fractures is the weight bearing exercises. And that's what I would like to discuss. All right. So, what are some examples of weight bearing exercises? We have two categories. We have the low impact weight bearing exercises, and we have the high impact weight bearing exercises. Low impact, what does that mean? That means you're not impacting your joints and your muscles as, as intent or as intense as the high impact. So the intensity is low. And so because of the intensity is low with the low impact exercises, it decreases your risk for injury. And I think that's very important, especially if you're greater than age 65 and you are a little fragile, meaning that, you know, a high impact, high intense exercise may not be as feasible because of maybe your fragility. And so there's still exercises that you can do that are weight bearing but low impact, but also have a high impact on reducing osteoporosis and improving your bone health. And so, what are some examples of the low impact exercises? Fast walking, my favorite. Um, so, fast walking outside, all you're doing is just basically walking, and walking alone can increase your bone health and reduce osteoporosis by putting that impact, just stepping, taking these steps, the force of gravity and your own body weight on your muscles, on your bones can actually improve the bone density. All right, so walking does that. Low impact aerobics, going to an aerobic class and just doing some low impact exercises at your local aerobics class at your local gym is really, really helpful. Elliptical training machines. I like the elliptical for my older patients versus the treadmill. I just feel like the treadmill can be dangerous, but the elliptical machine is less dangerous. Stair step machines, these are dangerous as well, but they are low impact, high impact as far as preventing osteoporosis and fractures, low impact as far as preventing injury. All right. My favorite, the easiest by far is walking. Just walking can help. What are some high impact exercises? Well, high impact exercises is aerobic dancing. So, these Zumba classes, dancing is really good. Hiking is really good because you're going up a terrain, you're going up a slope, which is really good because it adds more gravity and more impact on your bones. Jogging and running. And so, different from walking, now you're taking it up a notch as far as the intensity, but it's really good on the bones, jogging and running. Jumping rope, really, really good because you're jumping up and down and you're impacting your bones at a greater intensity, which in turn improves the bone health. So jumping rope is really good. Racket sports. So what is that? Racquetball, pickleball, tennis. These are really, really good. Really, really good for improving your bone health and preventing osteoporosis. So those are the exercises that we should do in order to improve our bone health and reduce osteoporosis. And so the question becomes, how often should we do this? Well, it turns out that doing these weight bearing exercises for at least 30 to 45 minutes uh, per day, not per day, I'm sorry, at least 30 to 45 minutes at a time, at least 4 times per week. So 30 to 45 minutes, 4 times a week. High impact and or low impact weight bearing exercises is good enough to reduce osteoporosis and improve your bone health. Improving your bone health meaning improving your bone mass, improving your bone density to reduce fractures. That's essentially what we're trying to do, is reduce fractures. All right, so let's summarize. Osteoporosis is very common in women age greater than 65 due to menopause, due to the loss of estrogen. So postmenopausal women are at increased risk of osteoporosis. And osteoporosis can cause fractures, especially after falling. So it is very important that we help reduce osteoporosis in order to reduce fractures. And one good, easy, cheap way to do that is weight bearing exercises. And there are various types of weight bearing exercises. Two main categories: low impact and high impact. All right, low impact meaning low intensity. My favorite is walking. High impact, higher intensity. My favorite is the racket sports: pickleball, tennis, racquetball. These are really good exercises. We should do these exercises 30 to 45 minutes, 4 days out of the week, in order to build our bone mass and reduce osteoporosis. If you are age greater than 65, it is highly recommended, especially if you are a woman, it is highly recommended that you get screened for osteoporosis with a DEXA scan. We should get screened every 2 years with DEXA scans. That would screen us for osteoporosis if you're a woman. If you're a man, USPSTF recommends that men 70 years and older should get screened for osteoporosis. All right, that's my time, guys. Bone health is very important because it reduces fractures, especially as we get older, because we are at increased risk of falling. And so let's do these weight bearing exercises. They're really easy. Just get out and walk, essentially, 30 minutes. Try to do it every day. It's easy, a brisk, fast walk. That's my time, guys. I love you. Like and subscribe. Leave the comments. Have a good day. All right. Peace.